Welcome to Voices of Privacy. Today, we have one of our own colleagues, Idris Adjerid, who is an associate professor in the Business Information Technology Department at Virginia Tech. And he's going to talk to us about the role of privacy in maybe constraining some public health tools. Welcome, Idris.
Thanks so much, Franz and Donna. I'm very, very happy to be here.
We're so excited for you to just kind of explain to our audience what your study was about and thinking about privacy and healthcare and issues and barriers, and especially everything that has happened in the last couple of years with COVID-19. So if you could kind of describe your study in, a couple of sentences that just really describe what your overall goal for doing it and then the outcomes that you saw.
Yeah, of course. So this study was conducted or started really right at the height of COVID, or as it was starting to kind of even out. And it was really quite a bit of this COVID vaccine hysteria and concern and rejection of this vaccine. And it was shocking to some people who maybe saw it as this miracle of modern science. And many of us were very excited and anxious to get the vaccine, while others were extremely hesitant and very concerned about it. And there were these, somewhat obvious and very powerful forces behind this hesitation, things like political polarization, viewpoints on the role of government. But one less obvious, we thought, concern was around privacy and data protection and identity. So that was what drove us in this direction, to evaluate the interplay between these concerns and the types of regulations states had in place. And of course, the uptake of this potentially life-saving vaccine that, also needed a lot of us to, take in order for it to be effective at a population level. So it wasn't just an individual choice. It was a choice that we kind of had to collectively make in order for everybody to be, better off from a health perspective. So it was this interesting tension that we thought was not immediately obvious and salient in the discourse around vaccine hesitancy at the time.
What made privacy concerns possibly happening with vaccines, which are really a shot in the arm?
This is an excellent question. In fact, it came up at a conference on privacy and digital economy. And throughout the day, people kept asking, what exactly is privacy? Because it seems like it's a quickly broadening concept. So what's interesting about the privacy aspect in the context of vaccine hesitancy is that it really intersects with all of these other dynamics in important ways. So if somebody has a concern about the role of government, for example, vaccine passports, which was a very contentious idea at the time, is that you'd have to hold some passport or some indicator that you had gotten vaccinated in order to get some basic services. People made that connection that in order for the government to do that, they need to store this information about whether I got vaccinated or not, and they would need to do it in an identified fashion, right? So if I'm going to get a vaccine and I'm being forced to identify myself, so I have to show an ID, and then I'm also told that information is going to be stored in an identified fashion in a government database. If I have those concerns about government and the overbearing policies and so on, then that privacy and that data collection and storage becomes related to that concern. There was actually also this cohort of people who wanted to get the vaccine, but had a lot of social pressure not to get it. So, it depends on what region you live in the country. So in some regions, obviously there's actually a lot of pressure to get it. And in other regions, it's like, no, you're kind of buying into this propaganda. Mm-hmm. So there would be individuals who actually would want to get the vaccine secretly. Like they wouldn't want to be seen or recorded. So it was this really interesting set of dynamics, and data privacy ended up really touching a lot of them. So it ended up being this thing that touched all these other elements of hesitancy.
You bring up something very interesting here, because this idea of how do I get some treatment without anybody else knowing about it, which is a huge privacy domain and probably applies to other public health situations. Do you have any insights on what we should do or governments should do in the future for handling this privacy? How do we let people know that their privacy is going to be protected, or maybe that it's not identified?
Maybe this is a good chance to dig a little deeper, or explain a little bit more what we looked at, because I think those are two dynamics which are really relevant to this discussion. So there's often this trade-off between privacy protections and some kind of value to the world. And that's true also in the context of public health. So for instance, the first regulation that we looked at was a regulation that required identification upon receiving a vaccine. So states differed in terms of whether they required you to show a government ID in order to receive a vaccine. And that has its own, obviously, benefits. From a public health perspective, for instance, early on in vaccine rollout, there was a desire to kind of to appropriately, vaccinate people in their own states, for instance, right? So there was a limited supply. States got a certain number of vaccines, and people were actually crossing state lines trying to go to states that had lower vaccine thresholds and all these other things. So there was this desire to verify your residency and verify your identity. So there was a public health benefit and some kind of administrative benefit of requiring IDs. At the same time, these requirements, for instance, scared people in the immigrant community, like we discussed, or individuals who had these other perhaps concerns about identifying themselves for one reason or another, or sharing their address. So that was one aspect of the protection. So you can imagine, from a policy perspective moving forward, maybe you want to think a little more carefully about, is really this residency requirement, is it really a top priority, or is it more important that people come and get the vaccine and, we don't worry as much about which state they live in? So that's kind of one trade-off that, policymakers kind of think about. Or what excited us about it wasn't just that, it was that we were actually testing the interplay between an offline regulation, right? This is a regulation to show an ID. It's not an online, it's not an online requirement. It's not a data requirement. There's no system involved. We were testing the interplay between that requirement and the requirement to digitize that information in an identified fashion. Mm-hmm. So states have immunization registries. They've had them for a long time. And they store in those registries information about immunization, again, for public health purposes. These are things that benefit us as a society to understand vaccination trends and so on and so forth. So if you had to show an ID, which means you had to verify your address, and then that verified information becomes stored in a government database in an identified fashion, that combination of things was very detrimental to vaccine uptake. But if you just broke that connection a little bit, this is very much a pro-privacy regulation result, because it turns out that if you have these identification requirements, they're quite harmful to vaccine uptake unless you anonymize the data you're storing in these immunization registries.
When you did choose to become vaccinated, they had a tracker on you, right? You could say, I'm going to sign up, I've been vaccinated, and then they would give you, whether you had a date to go get vaccinated or your post after your vaccination, they were collecting that. And then in many states, and I'll never forget, this was New York, and there was an app. So you can pull up the app quickly. So when you went to all these locations and they said, we need verification of your vaccination, you just showed the app. So there's that end of the people that are so digitally connected and just want to get the vaccination, but also know I'm time poor. If there's an app or something that I can use.
Absolutely. And I'll even add that I think there is also, kind of in the same way there were individuals with, extreme vaccine hesitancy, there were people who were hypervigilant about it, in the sense of not only did they want to be vaccinated, they would only interact with other people who were vaccinated. And they wanted to know if you were vaccinated. They wanted to see, that vaccine card and those people. That was obviously in many institutions and all these other kinds of things. So there's the whole spectrum of kind of preferences and approaches towards it. So there's a lot of factors that drive some of this.
And of course, there's going to be, in the future, more of these situations where we have to make decisions about being identified or not. and there's going to be benefits to that. And it's always going to be the same balancing act that we have to do. So that's very, very interesting. How did the people know that their data was not identified?
And this is a question we run into a lot with privacy research, in the sense of, oftentimes this information is buried, it's hard to understand, it's not very salient. So there's always and in this particular case, our understanding of these dynamics is that the people who were most affected by these things were actually quite aware of what was going on. For instance, in the immigrant communities, there's a lot of advocacy groups around the country, big cities, and so on, that were actually proactively communicating to their communities that, hey, ICE will not be enforcing immigration policy around these vaccination centers. You do have the right to opt out of storing it in these government databases. So there was an active information campaign for, individuals who were directly affected by it. And the other piece to it is that in these states where you had these requirements, when you went to get vaccinated, you would actually be told, if they were doing things appropriately, that, hey, we're going to store it and you have to sign away this piece of information. One interesting thing, and of course the ID part is very salient, right? Because you arrive, you have to show an ID, and it's just a requirement. But there was an interesting thing where one of our co-authors, Catherine Tucker at MIT, she actually wanted to test this. So in Massachusetts, you don't actually need to show an ID. So she went to a vaccine site and she tried to get a vaccine without an ID. They actually wouldn't let her. And it was kind of interesting. Perhaps, they just were not implementing the policy correctly, or they weren't fully aware. But this aspect, especially the ID aspect, that's hard to miss. But kind of our perception is that for the populations that were really concerned about this, they were aware of kind of the data protection or lack thereof from getting a vaccine.
That's very interesting. And, that's our goal at Voices of Privacy. And so thank you so much for helping us to understand a little bit better the role of privacy. And we look forward to talking to you again about some other future studies that you're going to run.
Perhaps, Idris, you will continue to track COVID as it remains the number 5 cause of death in the United States as of this recording. And looking future, I think there's going to be a lot of different impacts as it relates to people. And, I think we're over the aspect of just staying with people that are vaccinated. But I still think there's that consumer phenomenon when someone in a room says, yeah, I never got the vaccination. You're like, and especially if you have people at high risk with diabetes, with cancer, et cetera. So I think the conversation is going to continue, and your research is so important and so critical. So this is so helpful. So thank you for your time. Thank you for all of your work and your research. You are absolutely incredible, and we'd love finding out and you sharing this information.
That's very nice of you to say. I'm thrilled to be here. I'm really glad I could participate. Thanks for everything all of you are doing to kind of make people more aware of these issues and learn about them. So thanks.